I'm pleased to be here today and really want to thank you all for the opportunity to share with you some goals we all have around patient safety, quality, and person-centered care. A warm good morning to all of you. I am coming to you from Chicago, Illinois, USA, and I can tell you that it is probably much colder here than what all of you are facing there. And I wish so much that I could be there in person, but I'm honored to be with you on Zoom. I'd like to first take the opportunity to thank the Healthcare Accreditation Institute. Have had the privilege of being affiliated with HAI Thailand for, I believe, almost 15 years now through my tenure with first JCI, then Plaintree, and now Global Healthcare Accreditation. My first meetings were with Dr. Anuet Supachikul and then also Dr. Duang Samoran Bupadong several years ago, and really was so impressed by the commitment to quality, safety, and spirituality in healthcare. And moving forward now with the current leadership, I'd like to have the opportunity to thank Dr. Piawan Limpinariat and also Dr. Ekachitra Sukul for helping to move this progress even further along in Thailand and throughout the region and throughout the world. Again, watching the video and all that has already transpired is so inspiring, and I'm looking forward to being a small role in moving all of these efforts forward in Thailand and in the region. I'd also like to thank Dr. Samporn Kumpong, who represents Global Healthcare Accreditation as our executive director in the Asia Pacific region. So we'll go ahead and get started with our presentation. And first, I'd like to talk a little bit about Global Healthcare Accreditation and what we do. Global Healthcare Accreditation was really born out of the first certification program to recognize what was needed for medical travel developed in 2010. A formalized accreditation program was developed in 2016 and has moved along with two sets of standards that have been recognized and accredited by the International Society for Quality Assurance in Healthcare. We are so proud of that recognition and really are working collaboratively with ISQA and many other organizations throughout the globe to move the needle forward on quality, safety, and patient experience. But we are very much focused on the experience of the medical traveler and recognizing the particular unique qualities of individuals who are traveling for healthcare and what their needs are and what the organization needs to have in place to support staff, families, and patients who are traveling for healthcare. I'd also like to take this opportunity today to recognize some of the sites that are accredited by Global Healthcare Accreditation for their medical travel program within Thailand. We have Bumrungrad International Hospital with their wonderful program, one of the pioneers really with medical travel throughout the world, starting these programs decades ago and continuing to deliver the highest care and highest quality of services to medical travelers from all over the globe. I had also the distinct pleasure last year of visiting Ratchabrak Hospital in the Konkan area and could not tell you enough about the warm welcome that I have received there and all that they have in place to welcome travelers from throughout the globe as well as their local community. And Bangkok 9 International Hospital also welcoming travelers from throughout the globe. Global Healthcare Accreditation is so proud and pleased to be partner with these organizations. Our programs, however, are not limited to just accrediting medical travel programs within hospitals. We have several other programs that certify programs for wellness, hotels, and business practices, among others. We also have a certified medical travel program professional recognition. We're also pleased to recognize amongst our certified sites in Thailand, VitaLife Scientific Wellness Center, Inong Princeville Villa Resort and Spa, and Grand Richmond Convention Hotel as well. Now, moving along, we'd like to really talk about how your organization can grow a safe, person-centered culture. Our learning objectives today include the following. We want you to end this session by being able to describe the impact of communication with various parties on patient safety. Also understanding the impact of health literacy and disparities for patients and families. Be able to illustrate how staff support and teamwork are critical components of patient safety, and understanding the opportunities for growth with traveling patients and special considerations for safety within the patient experience. So getting started, we want to first focus on the main contributor to patient safety and experience, and this, of course, is communication. The Joint Commission estimates, and this is the parent organization of Joint Commission International, the world's largest and oldest accrediting body based in the United States. They estimate that 80% of serious medical errors involve miscommunication between caregivers and patients. And this is oftentimes focused on transfers and handoffs, where there are communication breakdowns, which are leading contributing factors of many types of sentinel events. Sentinel events being those events that are critical quality and safety errors that are leading to egregious outcomes and resulting in the need for serious reflection and root cause analysis within organizations. We see that the 2024 Joint Commission's National Patient Safety Goals, these are published annually by the Joint Commission and are a part of the accreditation program for organizations in the United States. They're reflected on each year, and while they change somewhat each year, they do have some common threads since they were implemented a few decades ago. Patient identification, improved communication, what we'll be focusing on a large part of our program today, medication safety, clinical alarm safety, healthcare-associated infections, improving health equity, identifying patient safety risks, and preventing mistakes in surgery. If you really think through all of these national patient safety goals, you will understand that if you do a deep dive, there's a common thread amongst many of them that really does lead back to communication. And many of you are very familiar with the International Patient Safety Goals published by the International Arm Joint Commission International, or JCI. These have remained consistent, and again, number one is identifying patients correctly. If we think this through, we can really talk about how this is a communication issue. Number two is improve effective communication. 3, look at the safety of high alert medications. Really thinking through, again, that there are communication components of all of these first 3, ensuring correct site surgery, reducing the risk of health-acquired infections, and reducing falls. Communication can be an element of all of these, perhaps a little more questionable with fall reduction, but we can come back to the need to communicate clearly and educate our patients about this and make sure there's an understanding with this with care providers and care partners alike to support the reduction in fall risk also. So how do we address communication improvements in our organizations? We need to think about breaking down the different elements of communication within the organization. So first, let's talk about the organization and how the organization itself communicates with patient and family members. First and foremost, we want to communicate clearly and compassionately what to expect when a patient is being admitted and entering the organization. We want to make sure we're communicating clearly about simple elements, things that we may not think about as staff members on a day-to-day basis, but that can be very stressful for those who are already in a very stressful situation with a compromised healthcare situation. Where do you park? I can tell you that throughout the world, many organizations that I have worked with on 6 different continents have had one unifying complaint when talking with patient focus groups, and that is parking. So being able to clearly illustrate this very simple piece of the puzzle in terms of patient experience is really the first step, the first impression that patients and family members have when entering your organization. Likewise, the very second piece of the puzzle is being able to find your way around the hospital. So how are we communicating to patients? Are we doing walkthroughs of the organization, looking at our signage, looking at our way of guiding our patients and family members around the organization that is clear to us? Or is it very confusing to patients? We become so familiar and so used to what's in our own organization, we need to continuously look at that journey of the patient through fresh sets of eyes. So one way is really talking with our patients, our patient and family advisory councils, and other patient focus groups to learn more and engage with them in how to address the best way to navigate the hospital. Likewise, no one wants any surprises when it comes to policies around visitation. We want to make sure that these are clearly communicated, whether in times of a pandemic or in times where there are calmer circumstances. We want to ensure that everyone is aware what those parameters are in terms of visitation, and also that there is an understanding if children are allowed and if our beloved pets are allowed in the organization for some of our longer term patients. Very important piece of the puzzle is to understand the role of care partners and to really have clear communication on what the expectations are around having those 1 or 2 designated individuals who are going to help support our patients and help care for them, not only while they're in our organization as a patient, but also the all-important discharge process and continuing the care at the home. These care partners are a really integral part of making sure that the journey of the patient continues smoothly upon discharge and the care is continued at home. So we want to make sure that our care partners are being taught, understand what is happening with the patient that they're going to be caring for, that they're confident in what they've learned, and that they continue on these processes once the patient is discharged and they're responsible for them at home. We also want to make sure that we have clear communication around meals, what's available, if there are certain dietary preferences due to a patient, especially a traveling patient, wanting to have that comfort food from their own area, from what is familiar to them. And if that's not available at the hospital, if food can be brought in, if there are certain circumstances where meals can be brought in and these particular wishes and desires within the parameters of dietary restrictions that are authorized by the care team are respected and also met. Likewise, spirituality, again, very important with the traveling patient that we understand that their spiritual needs may be different from what is more common with our particular patient population, and that these spiritual needs are respected and met. We also want to think about how the care providers are talking with the patient and the care partner. So thinking through that primary care physician or whoever is going to be meeting the most with your patient in your organization. We want to make sure that there is a very detailed care plan for each patient. And this really outlines by the practitioner what is to be expected from start to finish with a given procedure or what is going on with the patient in the organization during that time frame.